had anything happen here that we can't handle, and they've done a great job keeping their folks safe, and they are to be commended for that as well. It's remarkable, the job they've done at keeping those elderly folks safe and away from what's happened elsewhere.
This time, I'd like to make one quick announcement. We did have some exciting news today, that today we had an overwhelming success for a mask and a hand sanitizer giveaway for our seniors at our Office for the Aging Services in 3 locations throughout Chautauqua County. They're planning to hold 2 more. These events will be held on Friday, the 26th of June, and Friday, July 10th, all from 10 a.m. to noon, both days, at all 3 OFA offices located in Dunkirk, Jamestown, and Mayville. So, again, our guest last week was Dr. Marianne Spanos, and the Office for the Aging has done a tremendous amount of work to keep our seniors informed, getting them the information they need, and now the masks and hand sanitizer. So at this time, we're going to open this up to the media, as has been the case at 4 p.m. I have my control room call where we are continually asking those questions, asking for businesses that we feel are ready to be opened, getting the information from our group, our Western New York dashboard, and monitoring the progress we have here in Chautauqua County in Western New York. So we will start first with Mr. Dave O'Connor from Shawkat.
Thank you, PJ. First question for Dr. Burke. Doctor, the virus will, if I understand correctly, never go to 0 now, right? It's loose. So
That is correct.
okay. So when will we be able to not wear masks?
That's a difficult thing because we're seeing significant increases in parts of the country where people have either scoffed at this or decided that it is no longer appropriate. You know, there's been a lot written about when this pandemic is going to end. The pandemic ends only in 3 ways. You either have a vaccine or a medication. Those are 2 ways. And the third way is you ignore it. And if you ignore it, it doesn't go away. It just takes its toll until you have enough of the population that's immune or has survived, and then you have a low level of morbidity and mortality, which goes on as the virus finds those folks who are susceptible. And if you have a high enough immunity rate in the population, you have herd immunity, and then the virus basically goes away because it cannot be transmitted. So those are the options we have. Unfortunately, the only option we have at the moment are the ones already discussed.
Christine said the testing shows less than 1% positive. What would it have to go to not wear masks?
A great example is tuberculosis, which has exactly the same kind of mode of transmission, which is droplet. And what we've done over the last half century is been able to pick up a case and immediately contact trace around it and stop any spread. That's how we would have to deal with this, where you're down to a very low prevalence rate at the moment. And testing is extremely important now. It's actually the most important thing you can do in the sense of identifying those cases in low prevalence, because that gives you the opportunity to wall that off and to find the contacts, close them off, and then you isolate those little pockets. And so they may continue to occur, but like TB, which we actually continue to see cases, but as soon as we do, we're all over it with respect to contact tracing, and the spread is stopped. And we really have no vaccine against TB. BCG has been tried in the past, but it doesn't really work very well. But our ability to control TB is exactly the same thing. Find someone who's sick, find the contacts, test them, wall it off, treat it, control it. And that's what we would be in low prevalence areas. That is the ideal way to deal with this. Once it goes wild in the community, which is what you're seeing in the South, what we saw in New York City, you're a cooked goose. You are chasing, and you end up with very high mortality.
So masks could continue into the indefinite future?
Masks provide a very low degree of transmission from a person who is infected, but if you're wearing a mask, the latest data shows that your potential for getting sick from someone who is nearby is about 3%. If you're not wearing a mask, it's 17, 20%. So wearing a mask is probably a very good idea at the moment since we have no other means of dealing with this.
Thank you. PJ, when you go to your control room, what is the explanation given you for the difference between the interior of Chautauqua Mall and the interior of Wegmans or Walmart? Why is Chautauqua Mall so much more unsafe than Wegmans or Walmart?
They haven't given us a reason as to why one is more dangerous than the other. Lieutenant Governor is pushing to get them all open equally. We're following the guidance from the governor and their medical team, so there is no specific guidance as to what is safer than the other, but she continues to ask, we all continue to ask to get the malls open. I know the Galleria Mall in Buffalo is the same place. Only if you have an exterior door do you have access to those stores inside. So we're continuing to ask. We ask the same questions every day. She has a hot list that they ask questions every day of the governor's office, and that's one of them.
Thank you.
Moving on, from the Post-Journal, Mr. Dennis Phillips.
Thank you, PJ. My question is for Christine. Earlier today, there was a reported presumptive positive test at a nursing home in the county, and I guess my question is, with no visitors being allowed, employees at times were being tested twice a week, thorough cleaning of the facility was done. What does it say about how the patient at a nursing home facility still contracted COVID-19 despite the best efforts to prevent it from happening?
I think it tells you just how virulent this virus can be and how contagious it can be, and that's something we'll probably not ever have a scientific answer for as to exactly where that came from. I can't comment on any individual cases. We never do, and I guess you know that. We simply can't do that because of protecting privacy. I can tell you that we do follow up on all positive cases, and that presumptive positive is a word that I don't even like, because a positive is a positive, and for this New York State Health Department, we follow presumptive positive cases just like a positive case. When it comes to long-term care facilities and hospitals in New York State, locally we have no jurisdiction over them. Those facilities are licensed and regulated by the New York State Health Department, and I can tell you that our regional office out of Buffalo works really closely with the facilities in the county. I think in general we're very lucky. We haven't had outbreaks in our nursing homes and our adult care facilities in the county, as has been seen in downstate and even as close as Wyoming County and Niagara County. I still commend the staff and the administration of our long-term care facilities for what they do. But it must remember, when you are a worker in a healthcare setting of any kind, or any setting, or even dealing with your own parents or grandparents, people that are more vulnerable to illness deserve for you to use personal protective equipment. And if you are a staff member in a nursing home or a facility or a hospital, that's why it's so important, because we realize that life goes on outside of your work hours. So you have to be extra vigilant when you are at work. Anything?
Well, I think the point you made, Christine, about this virus being so virulent, all it takes is the slightest break from protective, being, wearing your personal protective gear. We see it in the hospitals all the time. We see it everywhere, where you get what we call nosocomial infections, or infections in hospital, where there's been just the slightest break, and it doesn't take much. These are pathogens which are very, very cunning and can get where they have to go. It's amazing what we see, and it's a constant battle for the attention of the individuals. People are tired, they're working long hours. All it takes is a little shortcut or some chance, a torn glove. There are all kinds of things that can happen. So again, we learn from these things. We don't call them mistakes. We learn from these incidents what can happen, and we just move forward and make sure it doesn't happen again.
It goes back to the importance of testing, of isolating, and keeping people from spreading disease once someone has a positive case.
Thank you. My next question is the 24% test results with unknown address. Were all those negative tests?
Yes, those are all negative tests.
Okay. Thank you. That's it for me today. Thank you.
Moving on, we just want to make sure in case you joined late, is anyone on from WDOE? Okay, we didn't want to skip over Dave Rowley. We're moving on to Terry Frank from Media One.
Yes. Hi, PJ. I did have a couple of questions. First of all, you mentioned the graduations and the fact that the graduates need to be congratulated for their graduating here at a very difficult time. I also know that late June, early mid-July is the time for graduation parties. And I don't know what kind of guidance or anything that's come out regarding that, but what kind of suggestions, if people want to go ahead with a graduation party, should they observe?
Well, the guidelines that are out right now, I think we have up to 25 people at an event. That's guidance that came out now with Phase 3. Will that change as we move into Phase 4? That is still unknown. We have seen with increasing phases, we have seen an increase in attendees to events. I've asked parents just to be mindful of that as you move forward and as you start to plan. There really hasn't been any guidance as far as graduation parties. I know graduation themselves, we've asked the question several times, and the governor is very firm at 150 individuals. But there really has not been anything from the control room on guidance for graduation parties themselves.
The only other thing that I have, since this is going to be the last formal press briefing as we go along through summer and such, we're all hoping that there is no second wave coming of COVID-19. But I wanted to ask generally, as far as those first, et cetera, if we do spike or a second wave, are we ready for it?
Well, I believe we do have a stockpile of our PPE. I believe that because of the low prevalence we've had right now, because of the, I would say, expertise in our contact tracing and having been through this, but not, devastated by this, that our teams will be able to, rally one more time and get the job done efficiently as we have so far. We are prepared. We've all talked about this on the county executive's phone call yesterday. Our best practices have been observed. We found what works, what doesn't work. And again, being a county that has not been infected as others, I've been able to sit back and bring this information to my team, share practices that have been used in Orange County, Suffolk County, Rockland County, Dutchess, Westchester, throughout the state, So we're going to take all of those tools, everything we've learned. And as John Griffith has said, we spend a lot of time preparing for the worst in the event that the best actually comes out. So we've been preparing. We will continue to prepare. We have our stockpiles. We are more knowledgeable, I guess, as you would say, as moving through this, learning from, others' mistakes and others' successes. So I believe if a second phase does happen to hit us, we will be ready for it. And again, the health and safety of the residents of this county will be our first and foremost consideration.
Okay, very good. Thank you for the press briefings. They've been helpful.
Thank you for covering them. I appreciate it. And moving on, Western New York News Now. Matt Hummel.
Thank you, PJ, but I actually had my question answered, so thank you.
All right, well, we'll move on. First of all, before we close, I'd like to thank our American Sign Language translator, Janelle Kruger, who has joined us each week. And we want to thank you for all of your efforts. And it's been really an honor. And to all of our local media who are on and who've covered and who are here with us today, You've bared with us through the unique challenges of holding a press conference during the COVID-19 crisis, and I'd like to thank each and every one of you for all you've done in getting the information out to our residents. And thank you for getting this important to our readers, to our listeners, and to the viewers. And everyone here in Chautauqua County. To wrap up, I'd like to wish a great and happy Father's Day weekend to all the fathers out there. And remember to support our local businesses as you move out and about Chautauqua County. You know, one thing that I've said when I first came into this position is what will happen is a unity of effort. And that unity of effort has been very very evident as we move forward. This happened in a very unique manner. It hit us by storm on March 15th, a Sunday, and our lives will be forever changed. And I know